When people work out or go to the gym, they're almost exclusively focused on muscles, notably strengthening, also to a lesser extent flexibility or stretching. I argue that the musculoskeletal system is not just muscles, it's also the skeleton. And the skeleton is bones, and where the bones come together, we call joints. So I argue that just as much as you consider muscle activity, you need to consider joint position and load. What I want to mention today is neck positions in exercises at the gym. For a lot of neck disorders, people coming to me with not only neck pain, but also headaches, dizziness, ringing in their ears, shoulder blades, shoulder, anywhere until the upper extremity down to the fingers, symptoms in those areas, a lot of those patients, 70 to 80%, have mechanical problems in the joints of the neck that can be resolved with one or two specific movements. For most of that cohort of patients, exacerbating movements include lots of flexion and protrusion. It's not all, but it's a lot. And those motions are usually the ones we need to talk about in terms of general lifestyle factors, for example, smartphones and laptops. But for those individuals who are working out, I also want to put on people's radar neck positions in the gym. So a neutral neck is when your neck is kind of upright. If you put a yardstick along your spine, it would run along the back of your spine and hit you comfortably in the back of the head, meaning that you are straight. There are many exercises, however, in the gym that for the person who's healthy, we don't really need to think about it. But for the person who's going through therapy, for the person who knows they are sensitive to a lot of flexion or protrusion of the neck, sensitive meaning it makes my symptoms come on, it makes me lose range of motion, it makes me lose upper body strength. For those patients, I want them to understand that there are things at the gym where they're in protrusion or flexion and they may not even notice it. 3 examples I commonly give are planks. Usually when people are doing planks on their stomachs or even on their sides, their necks go into a decent amount of protrusion. Secondly, bent over rows. If you're leaning over a weight bench, you're doing a bent over row, people's necks are often in protrusion for that exercise. And thirdly, not many people are doing this, but they usually know what I'm talking about with the preacher curl. If you're in that position for the bicep strengthening exercise, your neck is often in protrusion and or flexion. So if I give those examples, people can understand and kind of apply it to different things that they may be doing at the gym. But at the end of the day, I want people to understand that the musculoskeletal system is not just muscles. And since I find that 70 to 80% of orthopedic disorders are joint derangements, mechanical problems, problems with mechanics of joints that can be fixed by moving the joint in the direction it needs, which restores range of motion, restores any lost strength, restores any nerve tension to normal. For those patients, we really need to consider that the loads and the positions and the movements through joints in daily life and also at the gym, they can really matter. So we need to understand, if we're sensitive to certain movements and positions, how to correct those that are exacerbating so that we can be more symptom-free.